Coming up, find out about two new ACC member sections, one focusing on sports and exercise cardiology, and the other on CV care for the elderly. And later, discover how social media is offering new ways for the ACC to communicate with its members, and what President David Holmes has to say about it. And finally, we'll talk with ACC's Senior Vice President for Science and Quality, Dr. Janet Wright. We'll get her perspective on appropriate use criteria and how it's being applied in today's practices. Stay with us. Hello and welcome to this edition of the ACC Update for June. I'm Lisa Fletcher. You'll want to pay close attention to our top story. If you're not e-prescribing by the end of June, get ready to pay the price. The Medicare Improvements for Patients and Providers Act qualified e-prescribers to receive bonus payments for participating from 2008 to 2011. In 2012, qualified e-prescribers will be penalized if they don't successfully participate. But if you think you have until 2012 to avoid the penalty, think again. Despite protests from the ACC and others, the 2012 penalty will be based on e-prescribing data from January 1st through June 30th, 2011. This is why ACC is working diligently to ensure that CV professionals avoid the e-prescribing penalty. The college has several resources designed to help providers clearly understand the e-prescribing rules and requirements. To learn more, go to cardiosource.org/healthit. 1 year into a new health reform law, CV professionals are continuing to adjust to the changes affecting their practices. Last year's reimbursement cuts caused more than half of all practices to cut costs, including reducing staff, benefits, and salaries. A large number of practices also either merged or integrated with hospitals in order to survive. The ACC is continuing to address these issues. In January 2012, the college will host the Cardiovascular Care Summit, Solutions for Thriving in a Time of Change. The summit will focus on helping CV professionals to continue to adapt to health reform and market changes by offering new ways of using information and data, finding solutions to payment innovation, and exploring methods and strategies for collaborations between CV professionals and stakeholders. Learn more and register at cardiosource.org/CV Summit. The ACC recently launched two new member sections. The Sports and Exercise Cardiology section focuses on quality CV care needs for competitive and recreational athletes, as well as people of all ages who exercise regularly. Members on the section's council will play an important role in assessing how amateur and professional athletes are screened and how they are either disqualified or cleared for the next level of play. The section will also work to develop best practice guidelines. The Geriatric Cardiology section focuses on the vital needs of older adults with cardiovascular disease. Of particular concern and concentration will be the growing healthcare financial burden for older adults.
It's really important for all members of the college to get involved in this section. It's a way for you to really feel like you are contributing back to the college. It's a way to make the college more real for a member. I think the first thing is to go to the college website and look at what sections are available, see where your interest is, and then contact the staff member that is supporting that section, or contact the chair of that section, and then come to a meeting. Come to the annual scientific sessions where each of these sections or councils meet, and oftentimes there's going to be work groups that are set up, and show up, introduce yourself, and volunteer.
For more information about the sections, visit cardiosource.org/sports and exercise and cardiosource.org/geriatric. Popular social media sites such as Twitter, Facebook, and YouTube are changing both personal and professional communication strategies, including how medical information is transmitted. Through social media sites, blogs, and apps, ACC is reaching out via desktops, laptops, tablets, and mobile phones to deliver such information as practice guidelines, expert consensus documents, advisory panel deliberations, performance measures, and appropriate use criteria. In the June issue of the Journal of the American College of Cardiology, ACC President David Holmes wrote about technology and social media, saying it will never take the place of face-to-face encounters. However, it will offer unparalleled opportunities to reach the global world of cardiovascular specialists and patients and society as a whole. Holmes said an increased social media approach will expand options in delivering science and educating families. For more information on how to connect with the ACC on social media, visit cardiosource.org/ACC-in-touch. We're going to take a short commercial break. When we return, we'll get to talk with Dr. Janet Wright, ACC's Senior Vice President of Science and Quality. Stay with us.
Order the Type 2 Diabetes and Cardiovascular Disease Self-Assessment Program today. Expand your knowledge of the connection between diabetes and cardiovascular disease. Visit www.cardiosource.org/diabetessap for more information. Get the CardioSource mobile app, free. CardioSource's most popular and clinically relevant content is now available for your mobile device. Download today. Visit cardiosource.org and click on Science and Quality to learn more.
Welcome back. It's a pleasure now to be joined by Dr. Janet Wright, who is here today to talk to us about the appropriate use of imaging and therapeutic procedures. Janet, thanks for being here today.
My pleasure.
So this has been a hot topic. The Senate Committee and the Delaware Insurance Committee have both launched independent investigations after MedSolutions denied a Delaware man a cardiac stress test. What was this all about?
Yeah, unfortunately, this man was denied a stress test that his physician, his cardiologist, thought was indicated. And the man shortly thereafter ended up in the emergency room and subsequently in the operating room with an emergency bypass surgery.
So what were the key findings of the report, and what's ACC's perspective on all of this?
Right. What we're trying to do is say there's a better alternative to the radiology benefit managers. That's a blunt, bureaucratic tool used to reduce utilization of procedures. We'd much rather have science guide which procedure should be done and keep that decision between the patient and the physician.
So what's the ACC doing now in response to all these reports?
Yeah, what we've done is we're working on educating both policymakers and members of Congress and the public about the way appropriate use criteria have been defined and the way they can be used.
And what is ACC doing to ensure physicians are using appropriate use criteria at the point of care?
Right, that's the key, is to get the information to the practitioner at the point of care when the decision is being made, rather than postponing it to a later point in care by a bureaucrat. So what we're doing is trying to put tools in the hands of physicians. One of those tools is Focus, and more information about Focus is on the web.
Anything you want to add about this topic?
Well, I think we're all attuned to the economic aspects of care now, as well as the clinical aspects, and the appropriate use is bringing those two together in a way that's going to make a difference for the economy, but most importantly for each patient, one at a time.
And that is the ultimate goal, right?
Right.
Dr. Janet Wright, thank you for being with us. And to learn more, you can go to cardiosource.org/appropriate use. That's all for this month's ACC update. Be sure to stay tuned to cardiosource.org, where you can catch all the news from your college. I'm Lisa Fletcher. Thanks for watching.